It really is. And we've had a lot of fun just working together. It's been a blast. And one of the things that I like about the approach that we have in this clinic is that you really do nurture that provider-patient relationship. And we've been able to help so many people in even bigger ways than I would have thought just by sitting in the room and listening to the patient.
Hi, welcome back to The Naked Doctor. I'm Dr. Tammy.
And I'm Melody. Hi.
We have a great show for you today. Today we're just going to be talking about all things healing and medical relationship and advocacy, what you should expect, fear, all that kind of thing that plays in. So we'll talk a little bit about integrative medicine and what that buzzword actually means. And hopefully our goal is just to make life better for patients. And I think that's one thing that Melody and I both share is that healing happens when you have relationship with patients. And some people are hurting, and I always say hurt people do hurtful things, and it's, you always want to maintain a certain degree of protecting yourself if somebody's not being nice to you. Or, it's funny, we just had this week, we were notified that we were supposed to post a sign in our lobby that says assaulting a healthcare worker is a felony. And I saw one at the post office too, so we're not isolated.
Right, we're not the only ones.
But I guess we're required to post that. So that's very infrequent, I would hope. But, what has happened in our world that we have to post a sign? We make people angry enough that they want to hit us or worse, so. I don't know.
Well, I think just as a society, especially over the past couple of years, we've become more and more isolated. So people get so used to social media. And when you do nothing but post on social media all day, you can pretty much say whatever you want and you never have to deal with the real physical consequences. Like if I say something offensive online, I might get a couple of comments, but if I say something offensive to your face, you can reach out and punch me, right? But we've forgotten how to interact with each other, how to be kind to each other, how to be nice to each other. And it is really sad that we have to post it, hey, don't hit the healthcare workers, but unfortunately, that's the society that we're in right now.
Yeah. And the fact that in an outpatient setting, in a clinic setting, I mean, you kind of expect that with elderly combative patients or, some on the psych ward or someone being admitted from the ER, and having significant issues. The only time I've ever been hit by a patient is delivering a baby and our foot fell out of the stirrup. Got me right here, a little bloody hit too, but I wasn't bleeding. It was her blood.
Hey, I used to work labor and delivery, and we would always say what happens in the labor room stays in the labor room, right? But there are certain disease states, and not even disease states if you're having a baby, where you literally aren't really as much in control as you would be normally. So that's a different thing. But yeah, labor and delivery was such a fun field. I miss it. I do. It was a blast.
There's nothing like delivering a baby.
Right.
Oh my gosh. At 2 a.m. when you've been like running around all day, that's not the funnest, and it seems like that's when babies like to come.
It is. And then we just had a super moon recently, so the full moon, the gravitational pull of that actually does affect when women's waters break.
Oh,
fun
okay.
fact. So
I did not know that. That is a fun fact. That's one of the things I love about you. And if you don't know Melody, she's new to our practice, and well, not that new, a couple months now, but
yeah.
But just fun, and she has a way of saying things and just puts it together in a very easy to understand way. And for me, that was in med school. I always had to have a way to remember things or to relate to people, and
yes.
So that's a challenge sometimes. So if you have someone like Melody who can really explain, and when we come back, I want to kind of deep dive into that a little bit about what a practitioner is. And I didn't even realize the other day you explained to me the difference between a PA and a nurse practitioner.
Fun stuff.
So we'll talk about that in just a few minutes. We'll be right back.
When Dr. Tammy saw my medical records and saw the page full of drugs that I was taking for all my conditions, she said she could pretty well take care of everything that I had going on with me. So I decided at that point in my life that I was going to walking cane, I was falling and hurting myself, and tremors, couldn't talk very good. I had the mass face and drooling, 9 yards. Since then, all that has subsided since my first stem cell treatment. I had all these specialists, and all they kept doing was pushing more drugs down me. And the drugs cause enough problems as it is. And some of the Parkinson's medicine I was on is horrible. I won't ever take it. I was 45 pounds heavier than I am now. My balance was bad. My dementia was getting worse and worse. I couldn't remember from one second to the next. The Parkinson's symptoms had picked up on me and was really starting to accelerate. But it has relieved all that. I have no pain like that because that's muscle contractions. The excessive salavas went away. My hearing's actually improved. I got my smell and taste back, which I haven't had for 15 years. And when it comes back, it's like being born again, you know. It's like for the first time I'm able to smell something again, see whatever, and it's been remarkable in that instance, you know. The main symptoms of tremors are pretty well subsided. It's like, I feel like what it was 15, 20 years ago, when they were treating me for a nerve disorder. So many of the symptoms, I'm on Parkinson's website, so patients like me, the Parkinson's team, and I've got to where I just started telling people about it because this has been a miracle to me.
Welcome back to the Naked Doctor Show. I'm Dr. Tammy.
I'm Melody. Hi.
We were just joking during the break that I don't have any socks on. I came unprepared for the show today, and we decided we're going to do scrubs today too, which is good because that's what I brought. But we were joking about this is the closest I get to being the Naked Doctor. But it's funny because people always tease me about that, and it's the naked truth about health, wellness, and lifestyle. So we're here to really uncover some truths, and we get to the root cause of things, and we think that's really super important. And we used to have a radio show, and we would say, because people couldn't see us, we'd say, we promise we're wearing clothes in the studio. But I think that
Clothes.
But, the naked truth is when you can really help people understand that there is no mysticism in medicine. Doctors are not gods, and there is no magical power that we hold. I mean, the closest thing to that would be CPR. And actually, I had attendings tell me that if you're doing CPR, that person's already dead. Whatever you do at that point is between God and them. I mean, you have a procedure that you can do, of course, and medication, but not God's. And you have to be your own advocate. And there are many countries where you can get medications from the pharmacist without having to go through the gatekeeper being the doctor. And my disclaimer is I'm not telling you to quit your doctors and just do everything at home, because there's great value in acute care with medicine the way we have it. But in acute care, you're a patient. When you're looking at wellness or you have chronic illness, you become a consumer. And you have to be very aware of your choices and not informed consent and really having a relationship with your physician or provider. And if you don't have that, then you need to move on. And that's perfectly okay. And a lot of, especially the generation, behind us, they really feel like they have to put all their trust in the white coat and that's it. And that's, and you were explaining to me the other day about the difference between a nurse practitioner and a physician's assistant being the training. And so,
Absolutely. And it kind of comes from where each of these professions originated. So the big problem back in the day is that there weren't enough physicians to go around, right? It's still a problem, but there just weren't enough doctors to be able to take care of all the patients that needed care. So the doctors saw this problem and they said, you know what, we need some help. Let's create physician assistants. So physician assistant is not quite at the level of a doctor. It's like one level below. They can write a lot of prescriptions, but everything that they do has to be under a physician's supervision. So there's someone who is a doctor who's looking at all their charts, making sure they do everything correctly. You go into PA school and you do have to have some college level education to be able to get into that program. But then a lot of they do a lot of training, they do a lot of procedures, but they don't do a whole lot of patient care per se until the very end of their clinical rotations, and then they're out of school and they take care of patients and whatnot. Nurse practitioners kind of came about because of the same problem, except it's from the nurses' angle. Nurses said, hey, there's not enough doctors to go around, how can we help? So they invented the nurse practitioner role. You do have to have a bachelor's degree to get into a nurse practitioner program, but in addition to that, you also have to have at least 500 hours of direct bedside patient care. So a physician's assistant, they have all the procedural information, they have all the textbook information, but when you get to a nurse practitioner, this is somebody who has had to have at least 500 hours of face-to-face patient care experience, dealing with people, teaching with people, actually doing procedures and whatnot in the field before they're even allowed to be admitted into that school. But then as far as rank, so to speak, goes, physician assistant, nurse practitioner, kind of at the same level. As a nurse practitioner, I still have to have a supervising physician that reviews my charts and make sure that they're aware of all the procedures that I can do. They know how to do all those procedures. I've been supervised in all of these and signed off on each of the skills that I do that are above and beyond what a regular registered nurse would be able to do. So two similar jobs, just very different training, very different backgrounds of how these two particular entities came about.
When you say 500 hours, it doesn't sound like that many. It's in the term of hours, right? But when you think about a 40-hour work week, how many hours that is, I mean, that's significant. And that is par right up there with medical training, you know, and so I honor that. I think that a lot of times, you know, and one of the things we've even seen in this practice is we feel like we have to get permission for people to see you as a nurse practitioner. Like, is that okay? Like, it's second rate. And it's been my experience working with many nurse practitioners over the years that as far as relationship and patient relationship goes, that's who you want. You don't want the doctor with their hand on the door with 2 minutes and a script pad to just polypharmacy you to death.
Right.
You want someone who's going to spend time. And I mean, not every nurse practitioner might be that way, but for the most part, that's what I see is that there's just more of a cultivation because as a nurse, there's just more of a caretaking role. So if you are a nurse who's gone to the advanced practice, I really see that. So if you have a nurse practitioner, and so many of my patients who've said they've had them in the past, they prefer them. And with, you know, Melody doing thousands and thousands of injections for regenerative medicine, I mean, that's who you want. I mean, it's like drawing blood in the clinic. You know, the girls will come to me sometimes because we can't get this vein. I'm like, I'm the last person you want to look for a vein because I don't do it. You know,
Right.
and you want somebody who does it all the time.
Sure.
And so when you come to our office, I highly recommend that you ask for Melody right out of the gate because she's the one you want, you know, and I do quite a bit of injections, but I always say hormones are kind of my jam. So, you know, a menopausal female with all the hormone problems that I've had, that's really where I kind of focus. So bringing you in, because that's all part of it, you know, hormones and holistic wellness and looking at people with their makeup down to their genetics. You know, I think that's really important. So I think that's a nice symbiotic relationship too.
It really is. And we've had a lot of fun just working together. It's been a blast. And one of the things that I like about the approach that we have in this clinic is that you really do nurture that provider-patient relationship. And we've been able to help so many people in even bigger ways than I would have thought just by sitting in the room and listening to the patient. Because you look at a patient and it's not just a hurt knee, it's not just a set of hormones, right? It's an entire person and all of these systems that have to work together. So oftentimes somebody will come to the clinic because they think they have a hormone issue. We'll sit down, we'll talk to them, they'll tell us what's going on, and then they're like, you know, my stomach kind of hurts, I have eczema, there are these other things going going on, but I don't think it's my hormones, so we won't talk about that. And we're like, hang on, we can
Slow
help
down.
with that stuff too, right? And you have to think, your body is a whole unit. We're not just addressing one thing. We need to address the person as the whole, all of these different processes that are going on. And in functional integrative medicine, if we can really drill down and find the root cause of each of these issues, then we can help you feel better in all the ways every single day. And who doesn't want to feel as good as they possibly can, right?
Mm-hmm. I think one of the issues that comes up is because there is, I'll say this carefully, there is this very insidious thing in medicine, and I only say this because I really think that you as the patient need to be very aware of what the surrounding is. And in critical care, our ER docs, the people that are really getting after it and saving your life, absolutely. And there are many, many caring physicians, but part of the problem, and I'm not saying there are lots of people who do integrative medicine, but part of the problem is that if you look back at the history of medicine, there was a lot of really creepy things that the pharmaceuticals, the companies really sort of bought them, if you will. And that was one of the biggest energies that I had during med school, is I was like, am I just a glorified legal drug dealer, And so it was just like, you only have 5 minutes with the patient, because we developed this thing called insurance, which is a huge myth about you feel safety and you feel protection. Mm-hmm. And what I found is patients who had catastrophic insurance, they had great comfort in that. But if they had cancer, or they had a catastrophic illness or a car accident and were in the ICU, they still lose their house.
Right.
And there's so many things that insurance doesn't pay for. So when people come in, they have this expectation, well, you don't take insurance. So there's two things to that. Well, I don't want to do that because I don't know the value. So that's part of why we want to educate you about the value. But they also think that if insurance doesn't take it, that it must not be legit. It must not be real. And, so you kind of get into that. And so it really does become, I listen and I hear that, and I hear people say, well, I get my prescriptions for free. It's not just catastrophic. I'm like, okay, you get a $4 amoxicillin
Right.
every year when you get your allergies. So you're basically getting, some people pay up to $1,000 a month. So you're getting, $1,000 bag of amoxicillin or whatever, So it just doesn't make sense. But a lot of people don't realize how much they pay in insurance premiums because their employer's covering part of it or all of it. And so they just don't know. And so we just really are in this thought process in the box where it's just, you have so much time with a patient. So of course you have to write the prescription and the side effect for that prescription too. So it's just this system, and I call them commercial doctors. And I'm not knocking my colleagues, but there is an issue with that when you're just programmed to write prescriptions. Mm-hmm. And so you really got to kind of invest in yourself and look outside that a little bit. And again, we aren't the only ones that do that. But I am saying that if you need more than that, maybe look outside of that box a little bit. Mm-hmm. All right, they're saying it's time for a little break, so we're going to take a little break and we'll be right back.
In 2007, I was in an auto accident. A lady ran a red light and hit us, and I got a traumatic brain injury, and I got herniated and collapsed and compressed discs in my upper and lower back. I also fell down the stairs at work years ago, like 20-some years ago, and I had an ankle injury. The day that I was supposed to have my consult with the surgeon so that I could have surgery done on it, I had called over here and I got an appointment with Dr. Tammy. I was more excited to come in and have something actually done for it that didn't require surgery and a bunch of downtime. Up until that, I had been completely on the cane. I couldn't get around without the cane because it was that bad. And she put an injection in the front and one on each side, and that night I was off the cane. By the time I got home, I didn't need the cane anymore, and I haven't used it since. And my back, where I've got all the disc issues and things, I haven't had any pain in it. It's been awesome. And it's like they keep working for 3 months, and I'm just so excited to see, okay, in 3 months, if it's this different and amazing already, what's it going to be in 3 months?
When I was about 50 years old, I started gaining weight. I never suspected hormones. I didn't know what it was. I tried to cut back on eating. That really didn't work. And when I was about 58, I came home from work one day and my husband had watched Dr. Tammy on television. He had never watched her before and was telling me about hormones and what she was talking about and how it played into weight gain, and suggested that I visit her. And that was August 2020, and I did. And we did some blood work and she determined some hormonal issues and what we could try and what we needed to do. And I tried that. And along with her carb melt, I took that. And that was August 2020. And today, almost 2 years later, I have lost 27 pounds. And I feel great. I get compliments. People ask me, what did you do? And I always tell them about Dr. Tammy and the hormones and the carb melt. It seemed to be very effective for me. And I followed her diet plan. She had a small diet plan that I could follow, and I did. And I'm very happy. It's worked out great.
Hi, welcome back to The Naked Doctor. I'm Dr. Tammy.
I'm Melody. Hi.
We're having a little bit of a heavy conversation. Maybe we should say something fun, because it's like we're like, oh my
Why
gosh.
did the chicken cross the road? No, I'm kidding.
Oh, okay. You opened that up. The only joke I really ever can remember is, what do you give the man who has everything? Penicillin.
I love it.
That's my only joke.
can
I do know
can I
some
tell
blonde jokes.
Let me tell you my very, very favorite joke about patient privacy laws. Are you ready? I can't tell you.
That's good.
Nurse humor.
Nurse humor. Yeah, those are fun. You can like Google all the medical jokes and stuff, and sometimes only when you're in the medical field do you really kind of get them.
Oh my gosh, right?
But yeah, but they're fun.
No, so we're kind of talking about the commercialism of medicine and how corporations and the insurance company, we have to deal with something called prior authorizations all the time, because insurance does not want to pay. And so that false sense of, even if I get sick or, I need an MRI or CT, a lot of patients end up paying a lot for that, and they just don't realize what they're paying out of pocket. And then there's the investments, like I got clear liners on my teeth, the little clear braces, and that was $5,000 for that. But it was important to me because I crossbite, my TMJ was going wacky, and you'd think that would have been medically necessary because it was causing issues. But, sometimes you have to get outside the box. And I hate it when people come to us and they say, you're my last resort. I hear that all the time.
Yeah. Well, people go to their regular traditional commercial doctors a lot and feel like they're just not heard at all. And a big part of that is because of insurance regulations. There are more and more restrictions and time constraints on physicians, to the point that you have to see a new patient every 15 minutes or you can't pay your bills. Well, if you have chronic hypertension and other heart disease and COPD and diabetes and all of these really huge issues that you're not sure about, that you need to know more about just how to take care of yourself, your doctor pops in for 15 minutes, that's barely enough time to say hello, So being able to find a provider who takes the time to listen to you and drill down to all these things is very important, but also prevention comes into that and becomes very, very important, because if we as medical professionals can teach you how to take care of the body that you're in, then you get to not experience things like chronic diseases and things. You know, so many of the things that people have are preventable just by lifestyle changes, by education, and that's a huge component that I think is missing as well. So that's something that's very, very different about the way that we approach medicine here at this clinic.
Mm-hmm. I think we were just talking about practitioners too, that really there's more of that, which is so sad because the word doctor in Latin actually means to teach. And there is nothing, I mean, it's fascinating to study like the placebo effect and the nocebo effect, meaning that if you know what's in something, it can affect the way you think about it and how you interact with that medication or that procedure or whatever that is. And then the other part of that, the nocebo effect, is it's not double-blinded, so the practitioner actually knows if that's the placebo or not. And so they inject that feeling into that this is going to help you, or it's not, or it might, or we don't really think it will, or here's that, or, you know, and I hear that all the time too with patients who have said, well, they just threw prednisone at me, or, you know, something like that. And it was like, wait a minute, there's more to the story than that. And with people, you know, too, that the relationship is just so important because that's part of it. And if you know them and they have confidence in you, we just heard that this morning together, you know, the patient was like, I trust you. And I'm like, I'm happy that you feel that with us, and you should feel that with your provider. But the reason I hesitated was because blind trust is not okay. And you have to be your own advocate. I mean, if you've watched some of my other shows or videos, you know, I tell a story of I almost died and ended up in the ICU once because the doctors didn't listen to me, the nurses didn't listen to me, and and I was pregnant too, so it almost ended 2 lives because I didn't have an advocate there, and I was really crashing quickly. I had pneumonia, and it was a bad deal. So you have to have an advocate there, which is kind of one of the sad things that we see a lot is elderly people don't have that advocate, and they're not always, all their faculties are there to help make those decisions.
Right. Well, and patient education is so important. So when you are choosing a provider, you know, if there's ever a question, ask them where the research came from. Ask them where these ideas came from. Definitely get written discharge instructions for anything that you have questions about, because you need that information to be able to take care of yourself. And if you don't have that information, then the responsibility falls all back on the provider and nobody else. And that's not fair, right? Like we're not going to go home with you and make you eat a certain diet or make you take certain medications. So being able to understand how these processes work and how to actually take care of yourself is a very important thing.
And accountability and doing the things that you say you're going to do when you get home. And we never slap hands, but we always just encourage people to stay accountable to themselves, not to us because we love them, but that's still on them at the end of the day.
Ultimately, it's your health, right? So you want to take ownership of that, and you want to be as healthy as you possibly can be.
And we love you, and we want you to be healthy. And they're saying it's time for a wrap today. Always goes really fast. But you can find us and find more videos on our YouTube channel, and we do lots of Facebook stuff. So find us at Healing Art Centers, and the website is healingartcenters.com. And we also have thenakeddoctorshow.com, so you can see lots of our shows on there. Educate yourself. That's the best thing that you can do. Get your power. That's
Absolutely.
so important. Love you very much. We'll see you next week. Mwah.